Hello, everyone. Sam Feltham, Director of the Public Health Collaboration here. With me today is Dr. Matthew Phillips, all the way from New Zealand. So literally on the other side of the planet. It still blows my mind that we're able to do this, which is pretty cool. But for all intents and purposes, welcome to the PHC live interviews, Dr. Phillips.
Thanks, Sam. Pleased to be here.
Excellent, excellent. So you're a metabolic neurologist. So
Yeah.
do you want to explain to everyone how you came to be a metabolic neurologist?
Oh, that's a long story. It's too long for this short conversation, but basically I decided that there needed to be a new sort of subspecialty within neurology that dealt with metabolic issues in a lot of our most common and most debilitating disorders today. So particularly the brain cancers and neurodegenerative disorders. So I thought, well, there's no such specialty that really exists and addresses this from sort of a metabolic therapy point of view. And I guess I decided, well, I'd rather coin this term and proceed and sort of maybe start it myself rather than trying to fit myself into another subspecialty that didn't really suit my aptitudes and interests. So that's basically the essence of it.
Excellent. And you've not only had kind of an interesting professional journey, but kind of actual going country to country. So you grew up in Canada, right? Then you moved to Australia, and then you've ended up in New Zealand. Is that right?
That's right. About 26 years in Canada. So grew up in British Columbia on the West Coast for 17 years, and then spent about 9 years in the East in Ontario, and then 12 years in Australia, 3 years, as you say, traveling and doing different things, and then the last 9 years in New Zealand.
Awesome. And so what does your day-to-day look like at the moment now?
Well, I'm clinical and research with a fair bit of teaching thrown in. So basically, like today, it's 8 p.m. here. So today, just did some work in the morning on research, and then you do clinical work. So you see patients either as outpatients or inpatients on the ward rounds. And fortunately, I can skip lunch because I never eat lunch. I just have coffee throughout the day and water. And then, did a bit more work in the afternoon teaching and a bit more sort of reporting of nerve and muscle studies and things, which isn't terribly interesting. And so it's a lot of talking to people and trying to get to know them to a level where I can help them, help guide them with whatever problem they're experiencing. And neurology is very diverse, and there are many different problems that can arise, not just cancer and neurodegenerative disorders and those things. Those are some of the worst, but there are many other things. And so a lot of clinical stuff, research, and teaching. That pretty much sums it up.
Nice, excellent. And I'm really excited to have you at this year's conference, where you're going to be talking about mitochondria, terrain, and cancer. I was making sure that I got them in the right order because I had them in my head. Just jumping up. Do you want to give us a flavour of what you're going to be delving into?
Sure. I guess the way we currently view cancer is from a sort of cell-centric, germ theory-oriented point of view. And what I mean by that is we sort of think of cancer as aberrant cells within the body and the things around them as well, their environment. But we don't really pay as much attention to what's going on inside those cells. And there are, a few hundred or a couple thousand of these mitochondria inside cancer cells and almost all of the normal cells too. And these are what we call organelles. And these things, we used to think, for the last little while that they mainly generated energy, but we know now that they perform many crucial signaling functions and productive functions of hormones and other things. And basically, they probably, to a large extent, coordinate what the cell does and how the cell operates. And there's a lot of evidence that cancer originates within these mitochondria. So I think we need to adopt a mitocentric perspective if we're going to make significant headway. And then in terms of this sort of germ theory-oriented perspective, what we typically view cancer as is some sort of a disease process. It's historical. We sort of see it as a disease, in that we try to target it like we would like a disease, like a bacterial disease or something. We try to target and eliminate it, the cancer cells, with treatments that are based on things like chemotherapy, radiation therapy, and surgery, just removing them directly. And there are other ones, but that's sort of the way we view it. And I think there's a different way to look at things. Rather than a germ theory centric perspective, we can look at things from a terrain theory centric perspective. And a terrain theory perspective sort of looks at cancer as a problem of inherent dysfunction within the body. It's not an infection from, it's not really an infective thing. Or it's not like an external agent that came in, or an alien-like thing that arose. It's a part of the body that started going awry. And maybe the best approach isn't to target and eliminate it, or not solely to do that, but perhaps to aim at therapies that restore the body and can sort of maybe rejuvenate from within kind of approach. And at the end of the day, this is where we're going to have to go if we want to make headway in cancer as well, because people that get cancer got it for a reason, and you want to try and do more than just destroy or target and eliminate the current cancer. You want to heal the body to an extent where recurrences and things aren't such an issue. So you want to think long term here. So I'm going to be talking about this sort of mitocentric terrain theory approach to cancer, which I think is really needed to balance out the current cell centric germ theory oriented perspectives that we use today.
That's awesome. Really excited to hear that. And what else are you excited about seeing yourself at this year's conference?
Oh, well, it's always nice to meet lots of new people, speakers and participants included. So I'm looking forward to seeing the talks by the other speakers, particularly, of course, Professor Seafried, but also Isabella Cooper and Anthony Chafee and Dr. Westman and Dr. Unwin. There's a lot of great speakers that you've lined up. So congratulations to you for that. And there should be a lot to look forward to, I think.
Oh, 100%. It's just going to be such an action-packed weekend. And for all those watching, if you haven't got your tickets yet, we're literally 3 weeks away. So make sure you get your tickets as soon as possible. You can live stream or get in-person tickets if you go to www.phcukconference.org. And if you do get an in-person ticket, you still got access to the live stream. And you can re-watch it for up to a month after. Everybody that gets a ticket gets access to the live stream as well as the re-watchable recording as well. Everyone is welcome, both members of the public and also healthcare professionals, because we've got 16 CPD points for those that need them, and hopefully it will be more interesting than most medical conferences that you're getting CPD points at. Excellent. As you said, Dr. Phillips, it's 8 p.m. in the evening, so I really appreciate you coming on this late in the evening, right at the end of the day. But were there any passing words before we let you go?
No. Other than to say, I'll also be discussing actual results from a lot of patients in our clinical trials using metabolic approaches. So I think it's going to be a great conference, and look forward to arriving in England and joining.
Absolutely. No, that's fantastic. Safe travels. I know the journey quite well. I used to do winters in Queenstown. I used to be a snowboard instructor. I don't know if you knew that. So I did. I've done 3 winters in Queenstown, Southern Hemisphere winters. So I know it quite well. And I even went on my honeymoon to New Zealand with my 6-month-old daughter and wife as well. So,
very cool.
That was quite a trip with a 6-month-old. But
wow.
That's where breastfeeding comes into its own. It's like, just puts her to sleep. But anyway, thank you again, Dr. Phillips. Really looking forward to seeing you soon. And thank you again.
All right. Cheers.
Thanks. Bye.